Hello, this is Dr. Latasha McElwain. I'm here today to talk about the 12 core functions of substance use counseling. The 12 core functions of substance use counseling is a big part of being competent and understanding what's going on as a professional working in substance abuse services. So, I want to go through the 12 core functions here and just give a full idea of what is needed to become a competent counselor, competent therapist. All right, so for the 12 core functions, we have to look at the 12 areas that are included in our level of competency. So we have to understand what screening is, the intake process, orientation, assessment, treatment planning, counseling, which can involve individual therapy, group therapy, significant other, meaning couples therapy, or even family therapy. Next areas, case management, crisis intervention, client education, referral, program, excuse me, report and record keeping, so record keeping. Also, consultation with other professionals in regards to the client's services or the client's treatment. All right, so when we're talking about the screening process. Beginning with the screening process, we have our global criteria. So basically, the process of which the client is determined to be appropriate for and eligible for admissions into a particular program. So this is knowing kind of what the process is and what we are looking for when we're looking to bring a new client into the program. The global criteria basically starts with the to evaluate the psychological, social, and the physiological signs of alcohol and drug use. So we want to get that kind of evaluated there. We want to determine the patient's or the client's appropriateness for admissions or referral to the program. So we got to make sure that they are an appropriate fit for us. And then we also have to determine the client's eligibility for admissions to the program, basically of the referral or referral to the other or whatever the case may be. We got to make sure that the person is eligible and can come into our program. Um, then we have to look at the identifying any coexisting conditions, whether there be medical conditions, psychiatric conditions, physical conditions, or other type of conditions that can indicate the need for additional assessment or services that might be needed for the individual. And then we have to look at the fact that we have to adhere to the applicable laws, regulations, and agency policies govern alcohol and other drug abuse services. So we have to make sure that we are adhering to what the policies are for the program to make sure that we're able to do an admission. Okay. So basically, the explanation of the screening process is basically this function requires the counselor to consider a variety of factors before deciding whether or not to admit a person into the program. Also, it is imperative that the counselor use appropriate diagnostic criteria, so using our DSM to determine whether the person is definitely dealing with an alcohol or drug use issue that constitute, the fact of abuse. And then demonstration of the particular client's appropriateness for the program requires the counselor's judgment and skill, and basically is influenced by the program's environment and treatment modality. So if it's an inpatient program, outpatient detoxification program, a day treatment program, residential program, ongoing services, whatever the case may be, we got to make sure that everything is going to be moving appropriately through the process. Also, the eligibility criteria, basically making sure that we can determine that there's a focus or target population or funding requirements. If there are different things like that, we got to look at those things and make sure that we're meeting the eligibility criteria. And then also clients' age, gender, place of residence, legal status, veteran status, income level, and resource for referrals. a referral sources. I'm sorry. We have to be mindful of those when we look at the screening process as well. And then we also look at the applicant is found, if the applicant's ineligible for our program or inappropriate for the program, then we should be able to suggest alternative programs, be able to link to other services and reach out and get the supported information that we can support the client. Um, the substance use screening part that basically offers support and establishes rapport. We basically review the purpose of the call or the meeting while we're doing the service or while we're looking at the service. Gathering critical information in this process would be what we're doing during the assessing and the screening process. Basically, we are looking for, if there are any appropriateness for the screening assessment based on a review of the red flags, making sure that we're able to provide the service, getting that critical information. We're also looking at schedule and assessment or make the referral. The red flags are included in all of that. We also want to get the family, make sure they're involved. We are looking at what kind of legal issues are involved, what kind of employment difficulties are happening, what type of medical indicators, financial problems, and impaired conditions or alcohol and drug related behavior problems. So when we look at the intake process takes us to the administrative and initial assessment procedure for the admissions program, admission into the program. Basically, those global criteria start sending us into completing the required documents that we need for the admissions into the program. We also need to look at the program eligibility and appropriateness and then obtain the appropriate signed consents. And the consents is basically information that when we're able to reach out to third parties or we have to do outside get outside information, we will protect the client's identity and make sure we're not their identity, I'm sorry, their confidentiality. We will definitely make sure that we are taking care of that and taking that in consideration. We're also looking at the explanation of intake as basically intake often becomes an extension of the screening assessment and all that good stuff. So basically, we are the decisions to admit is formally made. And it is documented that we are intaking the person into the services, that we are looking at all of the various forms and keeping up with everything. We're also filling out the admissions intake sheets and we're doing documentation for the initial assessment, appropriate release for the the financial part of the um, for the individual, or also to get the consent signs for treatment and assign a primary counselor to the individual. So when we're looking at orientation, orientation comes along with making sure that they understand what the program is about. So general knowledge of the program, we pretty much give them the general nature and the goal of the program. We also talked about the rules governing the client's conduct. We talk about infractions. We talk about disciplinary actions. We also talk about different types of the program, whether you can be discharged, the actions that can happen. We some of the non-residential programs, they do talk about the hours of service and what's available, treatment costs, also talking about the patient rights. Global criteria here, we start to hit, we provide basically an overview of the program to the individual. We're also talking about the objectives and the goals. We're also looking at what's going on and describing the program rules, the patient's obligations and rights. And then we also look at an overview of the patient, of the program operations. Then we go back to looking at the explanation of the orientation, and that is to provide them before, during, and after with information of the patient's screening and intake. So the orientation is really talking about what's going on. It can happen, throughout the program sometimes. Orientation really tells us, what to expect. Also, we can conduct some of the individual, group, and family context in this time frame, talking about different things of that nature. And the portion of orientation include some personnel for certain specific aspects of treatment, such as what the nurse is doing, what the physician's doing, medication wise, and things of that nature. Now, we're talking about the assessment. When we get to the assessment is the process in which the counselor program identifies and evaluates the individual strengths, limitations, clinical issues for developing a treatment plan. So basically, we're gathering the relevant information. It's not limited to just alcohol use or drug use. We're talking about the person's entire situation, and we're doing the appropriate interview to do so. We're using interviewing techniques, and we're getting the information that we need to go ahead and complete the assessment. Also, identifying methods and produce procedures of basically collaborating information from the significant secondary source, like the significant other, or from other agencies as we're going. We're talking about the client's alcohol use, drug use, and psychosocial history. Also, looking at the appropriate assessment tools that we're going to use, we'll identify those and make sure that we utilize those as well. Um, in my program, we use something like the ASIMB. I've seen people use the SASE, so they're different type of assessment tools, and then explain to the patient the rationale for the use of the tools and why we're using it to help them understand what's going on. This is in order to facilitate understanding, and then develop diagnostic evaluation of the patient's substance use and coexisting disorders or conditions that they have. And then we're also looking to use an integrative approach to create the treatment plan so that we can basically make sure we hit on the patient's strengths, weaknesses, and identify problems and needs as we go. So the explanation of the assessment, again, is to continue our process of making sure that we're working with this person and able to assess them adequately to get the information we need. We also are getting a combination of focus interviews and testing and records to review. We are also looking at the counselor's evaluation of those areas. We're looking at the physical health, looking at the vocational development, we're looking at the social adaptations, we're looking at the legal involvement, we're looking at psychological functioning, we're looking at all those things that extend to the use of alcohol or drugs, which interferes in the patient's functioning in each areas of life. The result of the assessment should be focused on the treatment. So we're looking at now the treatment planning. So the treatment planning, this basically is an ongoing process throughout the counselor's work and the clinical team work to identify what's going on with the individual and help to resolve some of these needs and concerns, and rank the problems also, and then create short-term and long-term goals that we establish for the individual. Just like assessing continues to go an ongoing process, our treatment planning is an ongoing process. So when we the global criteria, we explain the assessment results to the patient in an understandable manner. So we use the layman's terms for them. We are also identifying and ranking the problems based on the individual patient's needs, and we're creating a written plan. We're formulating an agreement upon immediate and long-term goals using the behavior terms in the written treatment plan. We're also identifying the treatment methods and um, resources to be utilized as appropriate with the individual patient. We're also looking at treatment planning. So the explanation for treatment planning is basically based on the assessment, the information we got. We are going to use this information to come up with a tailored plan for the individual, as well as come up with the problems, the goals, the strategies to handle the specific issues and concerns. The goal statement basically identifies the problem and may include objectives basically intended to resolve the problem. There are short and long-term goals and strategies for all of them, and basically being able to help them with specific activities that are linked to or addressing the problems. Also, discharge planning begins at the time of admission. So another ongoing process there, assessment, and throughout the treatment. There's a lot of concerns around discharging because we want to make sure that we are on the right page when we get ready to start for discharging. So counseling is going to include the individual, group, or family sessions. Global criteria here is select the counseling theory that apply. We're also going to apply techniques that assist the patient, group, family in exploring problems and ramifications. Individualized counseling is basically based on the culture, gender, and lifestyle preferences. Also, we're going to look at the interact with the patient in the most appropriate therapeutic manner, elicit solutions and decisions for from the patient. We're going to also look at implementing the treatment plan, the utilization of specific skills to assist individuals, groups, and families in achieving objectives through the explanation of the problem and its ramifications, um, examination basically of the attitudes, feelings, and consideration of the alternative solutions and decision making. So psychoanalytical Adlerian, existential, rational, emotive therapy, cognitive behavior therapy, reality therapy. These are to name a few of the different types of counseling that comes along with services. I'll also mention motivational interviewing. So case management, basically the global criteria for case management puts us into the coordination of services for the patient. We are also looking at the rationale for case management activities to the patient to make sure that everything's there. We're doing case management, we're explaining it as basically providing the coordination of multiple services so that the individual is able to get with the case manager, some decisions can be made with the patient in order to handle some of the many dysfunctional issues or concerns that have manifest by the time the patient enters into treatment. And maybe this may be different things like a lack of a job, pending criminal charges, homelessness concerns, and very little family support or very little community interactions. And then also, we're looking at patients may also have medical needs that need to be taken care of and coordinated as well. Crisis intervention, global criteria. So basically, the to recognize the element of the patient's crisis. So the different type of crisis that they have, implementing immediate course of action appropriate to the crisis, and then enhance overall treatment for utilizing crisis events. Basically, a crisis is when there's a critical event that occurs and the course of treatment, um, basically, it's the course of treatment has been threatened. And so basically, because it's compromised or destroying the rehabilitation effects, these crises may directly be related to maybe use, overdose, relapse, indirect, including family death, family issues, divorce, arrest, suicidal gestures, psychiatric episodes, psychotic episodes, or outside pressures to terminate treatment. When coming down to client education, the global criteria is there presents relevant alcohol and drug use information, user information um, to the patient. Basically, formal process, informal process. When we're doing client education, we're definitely making sure that we are educating the clients on what's going on. We'll present information about the available alcohol and drug services and resources that are out there. The explanation for basically client education is for us to make sure that we are educating our clients. We are providing them a variety of ways to get services in place. We're letting them know where the services are. We're talking to them about different levels of service, which would be inpatient, outpatient, residential programs. We'll also look at using didactic formats with reading materials and films. Outpatient counselors sometimes provide relevant information to the patients individually and informally so that basically there are different self-help groups out there like your NA and your NA meetings and other resources that might be available to patients and families. Could be childcare resources, different things of that nature that we would try to make sure that we're explaining to the client and giving them some good education so that they'll have some things under their belt. When we're looking at referrals, so referral, basically global criteria for that one goes into the identity of needs and problems that the agency or the counselor cannot meet. So that's when we're looking to end up referring a person out and linking them to additional services. We're looking at the explaining the rationale for the referral to the patient so they'll understand why, matching the patient's needs or problems to the appropriate resources, adhering to the applicable laws, regulations, and agency policies governing the procedures, pretty much related to protecting the patient's confidentiality. And then we're also looking at assisting the patient in utilizing the support system and community resources available. So the explanation that goes behind the referral is basically competency and functional. And this function basically, so a counselor must be familiar with community resources, with whether alcohol and drugs and other services. So be aware of the limitations of the services and how the limitations can actually adversely impact your clients. So being sure that you're able to uh, you have working knowledge of the referrals and that you are able to include the confidentiality requirements and outcomes of the referral. So that's another big component to look at. So when we're looking at report and record keeping, so the global functioning there would be pretty much looking at preparing reports and relevant information. When we look at the global criteria, we're looking at the preparing of the reports and the relevant records to integrate. This should be integrated and available information to facilitate the continuum of care. So making sure that person's services can, go as they need to be with their care. So that's continuum of care. Chart any ongoing information, any pertinent information that needs to be supported and needed as pertaining to the client. And then, of course, utilize relevant information from written documents and patient care. So the explanation for report and record keeping is to make sure that this is a functional area that is very important, and basically it's for the benefit of the benefit the counselor to basically make sure that they have the documentation for the progress notes. The patient's kind of achieving the goals that they need to that they have in place. It facilitates adequate communication between coworkers so that one person pick up the chart, next person pick up the chart, information can be passed along for the most part. Also, supervisors tend to use this when they're assisting the counselors, giving them more feedback, providing them that in a timely manner, and also enhancing the accountability of the program and its licensing and funding sources. Consultation with other professionals in regards to the patient treatment and services. So when we're looking at the global criteria here, we're looking at recognizing issues that are beyond the counselor's base of knowledge and skill. So we're able to do a referral if we need to and be able to consult in other areas with different things that's going on with the patient, as well as consult with the appropriate resources to ensure provision of effective treatment services, adhere to the applicable laws, regulations, and the agency's policies, of course, making sure that we are taking care and we have the disclosure for the client's identity data. And then explain the rationale for the consultation to the client as to why it's there and when it's appropriate, making sure that those things are happening. The explanation for consultation is basically consultations when meetings are for discussion and making decisions and planning for the client's care. Pretty much there are regular in-house consultations that happen with staffing to try to make sure that the client's case is all taken care of and all together. And sometimes they have treatment teams as well. So staffing and treatment teams. The consultation can be done with individual sessions with the supervisor, other counselors, with the probation officer, the psychiatrist, other services that provide that are providers for the patient and connected to their case. Um, so with that, That is the skinny on the 12 core functions, giving you basically all the 12 core functions of substance use disorder. And this is what we tend to work from to make sure that we are providing all the services that we need when we're working with substance use or substance abuse, or doing our counseling in the substance use area. So, wanted to just kind of put that out there and make sure that everyone gets a good snippet of what goes on when we're talking about the 12 core functions, and when people need assistance moving forward with the 12 core functions because they don't really understand what it's all about. So, in the 12 core functions, we talked about all different levels. I'll just recap right quick that we are talking about screening. We're talking about intake. We're talking about orientation. We're talking about assessment. We're talking about treatment planning. We're talking about the counseling, which could be individual, group, family, couples. We are talking about case management. We are talking about crisis intervention. We're talking about client education. We're talking about referrals. We're talking about report and record keeping. And then we're talking about consultation of professionals in regards to treatment and services. So that's the client's treatment and services. So I thank you again for listening. And this is Dr. Latasha McElwain, just doing an overview so everyone can have an idea of what the 12 core functions are and be definitely aware of the competency level of what we should have as substance abuse professionals, knowing all about substance use disorders. So I thank you for your time, and I hope that you see us again for, or come listen to us again for some other presentations that we do in regards to substance abuse and mental health. Have a great one.